Dr. Groskopf presents spinal injury expertise and medical referrals for personal injury attorneys.
We have a variety of ways to support you and your clients get the best results and compensation, and ultimately your client's health get as great and as resolved as possible. So our primary focus here is for spinal injuries. We focus on finding those injuries that can be found on MRI, but also more importantly, we're going to find the injuries that aren't on MRI, and these are the more severe injuries that your clients are dealing with. The reality is most doctors are not trained on how to properly work up a spinal injury, diagnose it, document it, follow the guidelines, make sure that you have the evidence that you need so that if you go to deposition, if you go to trial, you have a black and white case knowing exactly what happened to your client. And there's very specific guidelines as far as treatments and everything that your client will need, not only for their case, but for their health. So first, spinal injuries is really our bread and butter. So if you have a client maybe who's not responding, maybe if it's been a year or so, you can't figure out what's wrong with your client, I'd be willing to almost guarantee that someone is missing a spinal injury. So send them into us. We can work up that injury for you. Secondly, I like to tell attorneys that if you were to send your clients to us, we're basically your one-stop shop for your clients, or we can quarterback the case, meaning when your clients come in, we're going to screen all of your auto accidents for spinal injuries. I guarantee most people are missing them. I find that up to 30% of your clients may have a rateable injury or a surgical candidate level of injury. So we're going to work that up for you. We're going to make sure the documentation is airtight, black and white for you. We're also an impact testing center, which means we're going to screen all your clients for TBI. And if we see any signs of concussion, we're going to get them to a medical neurologist. We're going to make sure that they get further testing done and everything is documented as far as that goes. We have a great network of people that I know and that I work with in the medical profession. So if they need an ortho referral or a PT referral, if they need pain management, we're going to make sure that your client gets to where they need to go. So not only are we getting them better, but ultimately we want a great case for you so that when we send them back, they're as healthy as they need to be. You have everything you need on your end to get them the best compensation that they need.